Good afternoon, everyone. How are you? Great. So first of all, a very respectful regards to all the distinguished members on the dais, Dr. Singh, Ambassador Singh, Dr. Kar, and Mary very dear friend and admired colleague, academician from IIITD Delhi, Dr. Tav. And thanks to organizers for this opportunity to meet all of you and share some of the experiences. As sir, you mentioned that I do not hold the healthcare related qualifications, but yes, have dabbled into industry for many years on strategy and corporate front, and now I'm embedding basically the industry practices into the academic world to create startups. So that is what we do as an incubator. But yes, I have seen very closely how AI has been a very significant accelerator in concept of healthcare. We have seen over years how the practice of diagnosis, treatment, data collection, drug formulation, how over the years that thing has got sped up. The speed of output, the impact, everything has got amplified through artificial intelligence. And the way AI has created the rise in performance across industries, whether it is aviation or defense or financial services. We have seen healthcare also moving significantly on the higher levels compared to what we had seen 2 to 3 decades ago. And this has been across the value chain of healthcare, whether it is from the user's perspective, finding a doctor or finding a treatment option, or in terms of supplies to the hospitals or hospitals providing services to the patients or other stakeholders. How the surgery has become more precise or have involved robotics, how the genomics are having the roles now, how the cancer diagnosis or treatment has become more precise, much advanced in terms of time. So there are a lot of things that we are seeing the changes around. So nobody can deny how AI has been useful. But in the meantime, somewhere I think we have got mixed up in AI and digitization and all. And somewhere in terms of improving the corporate side of the healthcare and in attempt to digitize the services, we have mixed up few things. But I think it's very human. As we keep trying new concepts or new applications, these are like those, I would say, overlaps would happen. So it is very natural to happen. But I think we all should remember, as healthcare service providers or as users of AI or the data scientists, that common denominator of all the healthcare impact has to be the user or the patient. Even if the attempt is to improve the quality of or to do cost optimization in hospital back-end operations, but still don't lose out the impact or advantage to reach the patient and the user. I think that is very, very essential. We must do that. To share with you, we as an incubator have been helping a lot of startups, particularly in the healthcare space, to use AI and ML. We have very strong association of the faculty who are experts in data science, machine language, computational biology, computer science, and they all work with the startups, and that is where the blend of technological expertise and the sector-specific expertise happens. So I think this could be helpful in how some of the hospitals or large service providers in terms of pharmaceuticals, they can use AI and the young energy levels and the innovative ideas which are there in the startup community to create those cohorts and to ensure that AI is enabled, embedded into all these. And through that, They are able to create new innovative products and services, again, for the benefit of the users or the patients, and they can use AI to deliver them. Yes, while we have seen advancements like Apple Watches or like Google Health or applications or the most advanced imaging devices or the most high-end life support systems, I need not go far. I have been the beneficiary of this. As a doctor, you would know what is an ECMO, which is for the external respiratory system. I was on that for 76 days. So I know how technology can save life. So, but yes, there are challenges. People do have adoption difficulty. They still trust a human being or a human interface vis-a-vis a bot or an app. So how do you bridge that gap? How do you create that humane element while continuing to have the cutting-edge leveraging of the technology part of it, so that the trust is there and people gradually adopt the technology-driven products and services? Another challenge is the data. A lot of time, because AI finally begins its exercise from data, if I say in a common language, it needs data as a base. So how close that test data is to the real world, how close is the validation data to the real world, and finally the solution that develops and iterates over the data sets. What is it, the quality of the data, or what is the size of that data sets? I think that is another big challenge. And of course, as I said, it is all model-driven thing. So one of the challenge, how could we solve these challenges? Can the hospital chains of this country, whether Apollo or BLK or government hospitals like AIIMS, Safdarjung, they have tons and tons of data. Can those data be merged or pooled together, keeping in view the data privacy laws? And their life becomes sort of an open source. How coding and all these things have got better? Because there are people in this world who have given everything to the society. Go and use it. So can data be made available to people, particularly who are the startups, entrepreneurs, or MSMEs, who need not then burn their time and energy and resources and efficiency levels to hunt for data? Can there be semi-built AI tools, like the way we get semi-knockdown furniture or equipment or automobiles, that they can quickly assemble few things and create a new product? Can there be white label kind of AI products? These are things that as policy makers or as industry influencers, Medical Association, AICRA, those who have necessary lineage into the government and all, can they create these kind of enablers that can help the industry and society? And of course, we will continue our role as incubator. We can become the contact or connecting point between the industry leaders or industry resources and young people. We can bring in those kind of best industry practices which can help both the ends of the value chain. So we are always there, and we will continue seeking support of the government and the highly learned people like all of you to come forward and help India as a country, and particularly the entrepreneurial segment, which can do wonders in this country. So with this, I thank all of you for your patience and hearing me out. I'm very happy to answer if there are any questions, and thanks once again. Thanks all of you.